What we want to introduce in this video is some of the common airway tools that we would use for securing an airway in an emergent situation for a patient who wasn't ventilating. So this would be for a situation if the doctor calls for a tracheal tube, intubation kit. One of the first things we'll need is what is called an endotracheal tube. These are found in the crash cart. They have multiple sizes. This one is a 7.5. We would also need a laryngoscope and a blade, and we'll go into this in a little bit. Also, you would want to have a 10 cc syringe, and we'll go into why you would need that. Let's look at an endotracheal tube. This would go into the airway. We have a stylet, which allows this flexible tube to become more sturdy when we're introducing it into the patient's mouth. We also have a laryngoscope handle, a laryngoscope blade. This particular blade is a Macintosh, so it's curved. You'll notice it has a light here as well. You might want to familiarize yourself with this before your simulation event. And the way these will work is they are snapping in, and you'll see that the light comes on, and this would be used for intubation purposes. We will use this for our simulation. The 10 cc syringe, you'll notice if you look at an endotracheal tube, there is a cuff. Once this is in the airway, the doctor wants to secure the airway and make sure that this cuff is fully inflated. And we do that with this syringe. Another airway tool that doctors may ask for, and we have in our emergency kit, is what's called a laryngeal mask airway, or the laryngeal seal. This is similar to an endotracheal tube, and the way it works, it actually fits above the opening of the trachea and forms a seal. Again, you would need a syringe to attach to this to inflate this particular portion of the cuff. And you'll notice that the laryngoscopes do come in many different sizes. The one that we had here was a size 4, but there's many different sizes. The size 4 is probably the most common. The airway system that I really like in the event of an emergency to secure a quick airway is what is called the iGel. It is similar to the laryngeal mask airway you just saw. Most common size is going to be a size 4. The reason why I like this particular airway, there is no cuff that we need to inflate. It is a much more sturdy type of airway. All you need is a little lubricant here, and this gelled entry surface is easy to get into the patient's mouth and then secure with oxygen and start ventilating for somebody. Another tool that we have in our office, and you'll want to at least familiarize yourself with where it is what is called the video laryngoscope. It comes in this red bag. And it's not important that you know exactly how this particular airway device is used, except for the fact that you get it to our hands quickly. It's going to be apparent that the doctor knows how to use this particular tool. In the red bag that we just showed you will come the video portion of the laryngoscope, as well as a couple different options as far as what we would use for intubation. This is called an unchanneled blade, and inside that red kit you'll see it's actually called the King Vision. It's a video laryngoscope, and what this does, the doctor would turn this on, and then he would attach the blade to it. If you'll notice, you'll start to see that there's a video component, and you could introduce this into the patient's mouth and be able to visualize the airway better. It's for difficult airway intubations. There is an additional system that we have for this video laryngoscope. It is the PEDS portion. So this is a little bit smaller connector, nothing different except a smaller connector and a smaller blade. The blade for the PEDS is a 2C, and for adults it's a 3. And the only difference for our video laryngoscope for the PEDS situation is that you want the blade apart, and you also want to take the battery component off. and then that fits the PEDS component. Now we have the ability to use this for children around the age of 4 to 10, 11, or 12. This is the video laryngoscope, probably the most important thing for our purposes, and what is really important for you guys to understand is to make sure this video laryngoscope has batteries. So about every 6 months we want to check them. There's actually 3 batteries. The last thing we want to be doing is trying to put batteries into a laryngoscope in an emergent type of situation. Anyway, these are some of the common endotracheal tools and airway intubation tools that we have in our office. Endotracheal tube, the King video scope, the eye gel, and the laryngeal mask Airway. We're going to use these in our simulations, and it's important to understand what they're for. Thank you.